Separate research from the UK, the United Nations, and the U.S. Centers for Disease Control finds teenagers and young adults who have not contracted COVID-19 are suffering from higher levels of mental health issues related to the pandemic than other age groups.
Young people have had their worlds turned upside down. They've not been with their friends, their routine has been broken, they've not been at school. We know they've felt anxious because it's been a scary world out there for children and young people. And so, yeah, of course, and actually, feelings of anxiety and stress are a normal response.
A CDC survey found nearly 2/3 of young adults aged 18 to 24 report experiencing anxiety, depression, or both. 1 in 4 reported seriously considering suicide.
I guess the largest presentation of mental health in young people are related to self-harm, to worsening of their depression, as well as to heightened anxiety where they feel that they need help.
Uncertain employment and educational opportunities are taking a toll, according to the International Labor Organization.
Young people whose education or the work was either disrupted or has stopped altogether were almost twice as likely to be affected by anxiety and depression as those who managed to continue to be employed.
The most vulnerable are often suffering the most.
The COVID-19 pandemic has a systematic, deep, and disproportionate impact on young people. We find the young women, younger youth, and those from the low-income countries among the hardest hit.
Researchers also found that 1 in 4 young people either began using or increased their use of substances to help cope with pandemic stress, despite the fact that they had not contracted the virus. The longer this pandemic continues, the more difficult it will be for many of them. Jim Spellman, CGTN, Bethesda, Maryland.